Have you ever been told, your blood tests are normal, but you still feel completely exhausted? Not just tired, but drained in a way that sleep never fixes. If that sounds familiar, you may be dealing with something far more complex than everyday fatigue. In this video, we'll explain what ME/CFS is, why it's so difficult to diagnose, and what modern treatment actually looks like. ME/CFS, or Myalgic Encephalomyelitis chronic fatigue syndrome, is a complex neurological condition that affects multiple body systems. The defining feature isn't simply feeling tired. It's something called post-exertional malaise, or PEM. PEM is a worsening of symptoms after physical, mental, or even emotional effort. Activities that seem small, like shopping, working, or even having a conversation, can trigger a crash that lasts for days. According to the UK's 2021 NICE guidelines, 4 core symptoms are typically present. Severe fatigue that doesn't improve with rest, post-exertional malaise, unrefreshing sleep, brain fog, or cognitive difficulties. One of the biggest frustrations for patients is that there isn't a single blood test that confirms ME/CFS. Instead, doctors first rule out other conditions that can cause similar symptoms, such as anemia, thyroid disease, or autoimmune disorders. Researchers are actively investigating possible biomarkers involving inflammation, immune function, and mitochondria, but for now, diagnosis relies on a detailed clinical assessment and symptom history. ME/CFS rarely exists in isolation. Many people also experience fibromyalgia, which causes widespread pain, or develop ME/CFS after viral illnesses such as COVID-19 or glandular fever. The growing understanding of long COVID has highlighted how viral infections can trigger long-term changes in the body's nervous and immune systems. Treatment has changed significantly in recent years. The old advice to push through fatigue is no longer recommended. In fact, the UK's NICE guidelines advise against graded exercise therapy for people experiencing post-exertional malaise because it may make symptoms worse. Instead, modern management focuses on 3 key areas. First is pacing, learning to stay within your personal energy limits to reduce crashes. Second is nervous system regulation, using techniques that help shift the body away from a constant fight-or-flight state. Third is identifying other conditions that may worsen fatigue, including POTS, mast cell activation syndrome, and sleep disorders. For many people with ME/CFS, traveling to appointments can actually trigger a crash. Online consultations allow specialists to assess symptoms, review previous investigations, and develop personalized management plans, all without adding unnecessary physical stress. The goal is simple: helping patients feel heard, understood, and supported. Although there is currently no cure for ME/CFS, there is real reason for hope. Research into long COVID has accelerated our understanding of chronic fatigue, with scientists exploring the roles of inflammation, blood flow, the gut microbiome, and the immune system. Most importantly, if you're experiencing these symptoms, know this: your illness is real. You're not lazy, and you're not imagining it. With the right diagnosis, pacing strategies, and specialist support, many people improve their quality of life. If you found this video helpful, consider subscribing for more evidence-based health content and share it with someone who may finally find answers.